to another Stoma podcast. My name's Sarah, I'm the lead Stoma nurse in Leeds community, and today we're talking about some of the common problems that you might come across after your surgery and talking about some of the myths that you might hear and kind of doing some myth busting. So I'm joined with Martin today and Vicky. So let's start with Vicky, like what sort of problems would a patient experience in either the short term or kind of couple of months after surgery?
So post-surgery, patients might experience quite a few different problems. Quite the common ones are things like ballooning, pancaking, leakages from the bags, sore skin, peristomal hernias.
Okay, yeah. And what was your kind of experience, if you don't mind me asking, Martin? Did you have any problems, or was you kind of told about problems that might have kind of come up?
I'm not sure I was told too many about these problems, but I did experience quite a few of them. Early days. Ballooning, definitely. A couple of times I thought, goodness me, my bag is absolutely full. But it wasn't.
Yeah.
It was just full of air.
Yeah.
So that was something I thought, oh, cracky. I've got to do something about that. Pancaking, yes, sometimes the poo doesn't fall into the bottom of the bag. And I've kind of got used to that as well.
Yeah.
And it's all those type of things. So everything you've mentioned, yes, I was struggling a bit at times with that.
And Vicky, just briefly explain pancaking. Martin's done a really good job of that, and just explain maybe how we can address that.
Yeah, so pancaking is where the poo sort of gathers at the top of the bag and doesn't sort of fall into the bag properly. So it's quite a common thing with colostomies. So we usually use things like baby oil or olive oil in the bag just to help lubricate it, just to help sort of the poo glide into the bag better. And we always say just amending the diet as well, just to see if we can soften the poo. Things like orange juice is a really good one just to help keep things a little bit softer, or sometimes patients might require laxatives just to keep it a little bit softer too.
Yeah, perfect.
Well, so also a couple of times, all of a sudden, my bag would fill very quickly with poo from nowhere. And that took me a bit by surprise.
Did it? Yeah. And has that settled down?
That's calmed down.
Now?
All these issues
have
calmed down.
Yeah.
Oh, I don't know. After 2 or 3 months, something like that.
And that kind of fits with what we would normally say, so wouldn't we?
Would you?
We'd say like it can take about 3 to 6 months after surgery for the bowel to kind of settle down.
Yeah.
Because the bowel doesn't like being touched, so it's a little bit, like in shock with what's happened. And obviously you're trying different diets and things, so it can be very kind of normal, and that fits with what your experience was. So thank you for that. And then you mentioned ballooning, Vicky. So what is that exactly?
So ballooning is where the bag expands with wind. So in terms of managing ballooning, what we would suggest is amending the diet potentially. So things like onions, garlic, that can all cause a little bit of ballooning. So we would say maybe to avoid those types of foods, or having things like peppermint that helps to settle wind, and it just helps to reduce that as well.
Yeah, and I think what you correct me if I'm wrong, Martin, some people produce more wind than others, and I think we're not going to get away from the fact that, we pass wind.
Again, it's back to this thing of embarrassment. When you've got, it's embarrassing having the bag in the first place. We all wear baggy clothing now, but if your bag's full of air, I think it's very noticeable. Probably other people don't notice it. But again, it's something that you just got to get used to. I now eat far less spicy food than I used to. I used to like quite spicy food, so I thought, I've got to be sensible here.
Yeah. Did that used to irritate you?
I think it did.
Yeah. Yeah, that's interesting. Yeah. Thank you. And what about any other problems, Vicky? So
patients may experience leakages from the bags. So in that instance, what we would do is maybe check the template size just to check that it's not too big, the bag, or it's not too small. Maybe we might change a product just to see if that will improve or reduce the risk of leakages. Sore skin, it might be that patients need certain accessories just to help heal that sore skin for that short period of time, and then they can just get back on with using their normal products.
Yeah. And did you have any leakages?
Yes, I did. Again, in the first 2 or 3 months, I had the leakages at night when I was asleep, and I must have been filling the bag, and maybe I'd been a bit careless and not stuck it down properly, and I woke up and it wasn't
Yeah.
very pleasant.
So a few maybe hiccups, maybe paired with like
I think so,
activity, like extra activity, and
Yeah.
obviously when you're asleep, you're less likely to check it. So yeah, so
I think it's just a fairly sharp learning curve when you go home with it. You are kind of on your own and you think, oh, goodness me.
yeah,
But you get used to it.
yeah,
3 months, I think 3 months in, I felt loads more comfortable. My bag was way, way better, and physically from my operation, I was getting better from then as well.
yeah, yeah. And we already established that you have a colostomy.
Yeah.
But you had a little bit of extra surgery as well, if you wouldn't mind.
I did.
just,
I don't know what the medical term is, but I had to have my backside removed,
yeah, yeah,
which turned out to be quite a substantial operation. So I've got a lot of scars in my bum. But when I got home, the first few months I was in a lot of discomfort. I could barely walk. I had quite a bit of bleeding from the scars.
yeah.
And I did have to wear sanitary towels, which again for a man is really quite
Be
embarrassing.
difficult, yeah, yeah.
But that got better week on week, and I could then start going for walks. I could go for a very light jog, and then it got better. It's like a lot of things, isn't it? If you're going to have an operation of that size, you're bound to have issues like that.
So actually one kind of issue that a lot of patients experience is something called rectal mucus. What is that, Vicky, and why might it occur?
So the bowel naturally has a mucus lining, and if patients still have their rectum after surgery, they may experience rectal mucus. It's very common for patients to experience that, and it's nothing to be concerned about, and it does generally settle over time.
Yeah. And what could be done if it kind of persisted after that 3-month period?
So patients can use things like suppositories just to help sort of clear that mucus away.
Yeah, perfect. And Martin, because of the nature of your surgery, obviously you didn't have that, but you had a wound.
No, I didn't.
Correct me if I'm wrong.
I have, yes.
So there was obviously challenges in that aspect.
Yeah, there were.
Yeah.
I think mine was much less of a problem. Mine was just a physical recovery from surgery.
And I think it's really hard because, we see patients right after the surgery and, we try and say it does get better. What would your advice be to someone who's at the start of their journey?
It's dead easy for me to say now, well, you've just got to be patient. It's not going to be pleasant. Don't think it's going to be pleasant, because it's not. It's very unpleasant. However, the end result is 1,000,000 times better than when you started.
Yeah.
But to convince somebody that, just be patient, it's very difficult to do that.
Yeah, yeah. And was you told about the sort of problems that you might experience, or?
I don't think I was. Again, at the time, you didn't really absorb too much information coming at you, but I don't think I was told about things like sanitary towels and leakages and stuff like that. I might have been, but I don't think I was. I think it would be really good to try and get that message across to people. So when you do go home, I'm afraid you've got to get ready for this.
Yeah. Okay, that's good. Well, hopefully this podcast will help with
absolutely.
that.
Thank you for sharing that.
Pleasure.
Yeah, well, thank you to you both. So thank you for tuning into the podcast today. Please join us on the next one. If you have any questions or concerns and would like to speak to a stoma nurse, then please do contact our service on 0113 843 3715, or alternatively email lcht.stomaserviceleads@nhs.net.